Hi, my name is Mark Lubitz, and I'll be guiding you through this week's medical research update. The first study that came out this week was an important one in that it was the first randomized controlled trial to study the effectiveness of thymectomy on patients with myasthenia gravis. Thymectomy with prednisone as compared to prednisone alone, it improved clinical outcomes over a 3-year period, thus justifying the typical treatment that has been used for years. Patients had less symptoms, a less subjective distress level, less progression to treatment with azathioprine, and less hospital admissions with thymectomy as opposed to just prednisone treatment. Next is a study comparing the outcomes of fresh versus frozen embryos in patients using IVF for polycystic ovarian syndrome. This study showed that for patients with polycystic ovary syndrome undergoing in vitro fertilization, frozen embryos offered a higher living birth rate, a higher chance of preeclampsia, and a lower risk of ovarian hyperstimulation syndrome. This study could have important implications for women with polycystic ovary syndrome who are trying to have children. This next article is from the Federation of State Medical Boards talking about the use of marijuana in medicine. Marijuana use has risen from around 4.1% in 2001 to almost 10% today. It's been suggested that marijuana could help with certain diseases like cancer, Alzheimer's, PTSD, and MS. However, there's been little clinical evidence that can show this benefit. Additionally, marijuana is still illegal under federal law where it is a Schedule I controlled substance, meaning that it has no accepted medical use and a high abuse potential. The Federation of State Boards urges physicians to use caution if they're going to prescribe medical marijuana, to prescribe for no more than 12 months at a time, and to exercise other options before resorting to marijuana. Also, they mention that if you are a physician who lives in states like Colorado or Washington where recreational marijuana is now legal, to of course abstain from using it while practicing medicine. Next, I've got some information for you on the new FDA Nutrition Facts label. The obesity epidemic in this country is costing us over $190 billion a year. The Nutrition Facts label has been standardized by the FDA since 1993, but has been changed very little since then. Most recently, in 2006, trans fat was added to the nutrition label, which has led to a massive decrease in the addition of trans fat to foods by food companies. Since 2000 in the United States, we've seen a decrease in overall blood lipid levels and a decrease in the prevalence of type 2 diabetes. That can largely be attributed to the decrease in average daily trans fat consumption from 4.6 to 1.3. The newest target for the FDA will be reduction of added sugar in beverages, which will now be listed separately on the food labels, hopefully making people more aware of what they're eating and hopefully incentivizing food companies to decrease added sugar. Also, there will be more emphasis put on serving size on the food labels. So for instance, right now if you buy a 20-ounce soda, it's still giving you the caloric information for 8 ounces or a serving size. Now that will change so that all the nutrition information will be for the one single serving being the entire bottle. These changes won't take effect until late July of 2018 and even later for smaller companies. However, they should have a rather profound effect and hopefully will decrease the burden of obesity on our country. This next study was a rather large one, studying the prevalence of diabetic kidney disease from 1988 to 2014. The study showed that the overall prevalence of diabetic kidney disease did not change. However, the prevalence of microalbuminuria decreased and the prevalence of having a decreased EGFR increased. In the past, it was thought that microalbuminuria was a step on the pathway to having a decreased EGFR. However, these studies show that that might not be exactly the case. It's also important to note that these changes were only seen in non-Hispanic whites younger than 65 years old. The authors hypothesized that the increased rate of prescription drugs to treat diabetes and lower blood sugars has had the effect of decreasing the protein levels in the urine. This study is important because it shows that diabetic kidney disease is now presenting differently than it was in the past, which has ramifications for treatment and clinical studies. Lastly, there was a rather sad article published about the role of physician-assisted suicide in the Netherlands for patients with psychiatric conditions. In the Netherlands, physician-assisted suicide is legal and was typically used by cancer patients and other patients with terminal illnesses. Now this role has been expanded to patients with intractable psychiatric illnesses, most commonly depression, but sometimes PTSD and anxiety as well. Although this issue might not be relevant for people practicing medicine in the United States, it brings up an important point that psychiatric illnesses like depression, anxiety, and post-traumatic stress disorder currently are not being treated effectively, and there's a lot of people who are contemplating suicide and have been treatment refractory for many years suffering from these diseases. Thanks for tuning in. Stop by next week for more.